Hello, I'm Dr. Dominic Stape. I wanted to go over something very important for those of you that are in practice or you have a business or you're concerned about growing your practice or your business. There's something we call the 5 levels of clinical success, and it's about making ideas happen. So with successful business practices, what we do is we help business owners and specifically clinicians and acupuncturists to grow their practice to levels that they desire. And it happens through different ways of understanding. And so I wanted to introduce this to you. We have ideas of how we want our clinic to be in a year, in 3 months, maybe 5 years, but we have to know where we are. And so I'm going to go over these 5 levels, and each level has a significance to it. The significance of busyness related to maybe if you have staff, if you don't have staff, or if it's just you. Also, we have to look at organizing the office. So we look at practice management. We look at management of systems and management of procedures. So the first level here is where you're just starting out. So if you're just starting out, you're at level 1. And there's no real statistics to be viable. There's no real, you're barely seeing anybody during the week. You're dependent on outside income influence, financial influence. You're getting money from other places. You're just starting up. Only a few people you're seeing, maybe 1 new patient a week. And this is where you need to start looking at promotion and marketing. You need to start putting yourself out there more, making people know who you are, making yourself known, who you are, what you do, and what you offer. This is where the self-confidence and the consultation and putting people on a plan or some kind of idea of where they want to go and having a plan for them to get there. That's level 1. So if that's you, you're at level 1. Level 2 is you're seeing more than 1 new patient a week. You're treating about 20 patients a week. You break even with income and expenses or so. You implemented the consultation and you're doing somewhat of a report of findings and you're doing a plan of care. And you have people maybe coming in 6 to 12 visits, hoping that they get better. This is where you need to hire a receptionist or a manager or somebody up front to help you. So if that's you, you are level 2. The next level is level 3. Level 3 is you're seeing multiple new patients a week. You're about 40 patients a week. You're seeing 40 patients a week. You're making a small profit usually at this point. You're able to feel some expansion. 50% or more of the people that come in your door are committing to care. And this is where you need to hire a marketing director, maybe an office assistant. You need to start using clinic systems to organize the patient flow, because the patient flow is coming in and you're getting a little confused. You're feeling a little overwhelmed. And you're seeing maybe 6 to 8 patients per hour, something like this. So that's level 3. Level 4 is where you're having multiple new patients. You're seeing about 80 or more patients per week. You're feeling busy. You're feeling a little pressure. You're feeling a little overwhelmed. You have receptionists and marketer busy. You start working independently and using statistics to measure your staff production. So this is, maybe you're not completely using all of this, but you should have some of this going on. 80 patients a week, something like this, or you're just feeling very busy. This is where you need to train your staff weekly, manage your office with statistics, and hire an associate. So that's level 4. If that's you, those are some ideas for you. The next level is level 5. This is where you're seeing 100 or more patients per week. You're feeling overwhelmed, you're feeling overworked, and it's time to let the staff run the office so you can sit back and conduct the symphony. So what it is if you're at level 1, you're really not seeing anybody, you're just starting off. If you're level 2, if you have 20 or more patients per week. You're at level 3 if you have 40 or more patients a week. You're at level 4 if you have 80 or plus patients per week. And you're at level 5 if you're 100 patients per week or more. And so what we do is we do a practice analysis to see where you are, what level you're at, and what kind of help you need. And that's what we do. is we help you go from one level to the next level so that you can start acquiring your dreams and having the practice that you've always wanted to. So I invite you to click the button on our website and request a practice analysis. Contact us so we can help you, and we'll make the journey so much more smooth. Thank you.